For those in the dental profession, you guys know the DSO movement is continuing to pick up momentum on a daily basis. And so for those that don't know, a DSO stands for a dental support organization. They run and manage the non-clinical aspects of the dental practice. So they're doing HR, they're doing insurance credentialing, they're doing property management, they're doing everything outside of the clinical setting. And in my opinion, in our opinion here at Lat Dental Group, we expect the DSO movement to continue to gain market share. And I think it's going to continue to accelerate at the rate it's at. And I think there's a couple factors that go into it. I think in a post-2020 world, things are very, very complex. A lot of different factors are still kind of rebounding and coming back from the pandemic. So I think that's been very disruptive. I also think another thing that doesn't get talked about very much that I think is going to be a huge move in our overall goal here at Lat Dental Group is for us to provide a work-life balance for our providers. So again, when they can go home at night and truly get rested and reset for more patient care the next day. Now that most offices are 4 to 5 days a week based on the margin contraction, it is really hard to see patients 40 to 50 hours a week and then do all of the back-end management. That has just led to a lot of burnout, and it's led to people not enjoying the profession. So the DSO movement has accelerated because of that factor there. And another thing that I think is really playing in on this, and it's going to continue to move that way as the margins get contracted, is the margins at a DSO that are well run are going to outperform a solo practitioner. You get economies of scale, you get economies of labor, you get some things in your benefit in a pretty major way that you just don't have access to as a sole proprietor. You get a lot of synergies again as you continue to grow. Here at Lat Dental Group, we have a denture lab that helps with the vertical integration. We have some specialists that helps with vertical integrations. All of those things really help in terms of, again, our overall margins. So, and I think again, as the profession continues to evolve, as we've seen labor prices and labor inflation kind of go through the roof while we work on fixed contracts, I think it's going to be very interesting in these next 5 to 10 years to really look at the compensation levels between associates and provider owners. And I really think the well-run and efficient DSOs are going to be able to outcompensate the sole proprietorship based on the margins that the DSO is able to get, as long as it's well run and as long as it's provider centric. Again, that is the number one thing that it has to be. Our model only works, the DSO model, in our opinion, only works with really good dentists. Really good dentists want autonomy and deserve autonomy. So that is our goal, is to help on the back end stuff, everything outside of the clinical setting. Let the dentist do their work and do their magic in the clinical setting, and let us do the back end staffing, credentialing, all of the other things that just, again, continue to operate and allow you guys to see the patients that you've been trained to do so. So stay tuned for more content from us, but from a high level, that is, I think, some of the factors that are driving this DSO movement.